Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us today is Dr. Dina Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Before I get to today's numbers, I want to let Albertans know about international reports of a rare condition appearing in a small number of individuals after receiving an mRNA vaccine. The WHO, the CDC, and the European Medicines Agency have reported rare instances of myocarditis and pericarditis following vaccination with COVID-19 mRNA vaccines. Myocarditis is inflammation of the heart muscle, and pericarditis is inflammation of the outer lining of the heart. In both conditions, the body's immune system causes inflammation, often in response to infection or some other trigger. This is being reported after vaccination most often in younger males and more frequently after a second dose of vaccine. These reports are very rare. It is not yet known if there is a relationship between these reported instances and any COVID-19 vaccines, but all reports are being investigated to understand what happened. The Public Health Agency of Canada and Health Canada, along with my team in Alberta and other provinces and territories, are reviewing reports and monitoring for any additional information. To date, Canada is not seeing higher rates of these conditions than would typically be expected in the general population. And we have had no reports of either of these conditions after vaccination in Alberta. We will continue to work with the Public Health Agency of Canada and other provincial and territorial partners to monitor the situation closely. We are sharing this as part of reminding Albertans that we take vaccine safety very seriously, and we will always be transparent about any new information that emerges. It's important to remember that these are rare reports of a condition that is known to happen due to other triggers, so it is not clear yet what link, if any, is with vaccines. The bottom line is the vaccines we have save lives. They are incredibly safe and the best way to protect your health. Turning to today's numbers. Over the last 24 hours, we have identified 296 new cases of COVID-19 and completed about 6,800 tests. Our positivity rate was about 4.6%. We have identified 305 additional cases of variants of concern in the last 24 hours. That is cases that extend further back historically, which is why that's larger than the total number of COVID cases. There are currently active alerts or outbreaks in 364 schools, which represents 15% of all schools in the province. Again, this represents a number of outbreaks declared within the last 28 days, which includes some outbreaks prior to the 2-week closure. Hospitalizations continue to decline, and there are now 411 people being treated for COVID-19 in hospital, including 120 in the ICU. Sadly, 5 new deaths were reported to Alberta Health in the last 24 hours. We must never forget that these are not just numbers. They are people who lost their lives to COVID-19 and who leave behind family and friends who are grieving them. My thoughts are with everyone who is mourning a loss, whether from COVID-19 or any other cause. I want to talk briefly today about a change that was made yesterday around contact tracing for variants of concern. With the lab now screening all positive COVID-19 cases for these variants, case investigation teams will now be restarting second calls for cases with variants of concern other than the B.1.1.7 or UK variant. The second notification will allow AHS to do even more in-depth investigations to find out where the case may have been exposed. While it remains critical to minimize transmission of all COVID-19 cases, we want to pay particular attention to the lower volume variants of concern, specifically P1, sometimes known as Brazilian variant, B.1.351, sometimes known as the South African variant, and B.1.617, sometimes known as the Indian variant. In these cases, we have opportunities for more aggressive containment. As the B117 variant is our dominant strain, we will not be doing second calls for these cases. And these second calls are in addition to all the other case investigation and contact tracing work that happens for every single positive case. We have now administered more than 2.88 million doses of COVID-19 vaccine in our province. This includes more than 44,000 doses yesterday. I'm pleased to see that there has been strong interest in booking second dose appointments among those who got their first dose in March or earlier. For months now, I and other medical experts have stressed the importance of getting vaccine. This is because vaccines work. They save lives, and they are our path out of this pandemic. Today, I'd like to share some preliminary real-world data showing just what that means in our province. This data is from the cases that we've seen in Alberta, and it's clear that vaccines are remarkably effective. Let's start with cases. Since January 1st, 96% of all confirmed COVID-19 cases in Alberta were either unvaccinated or diagnosed within 2 weeks of receiving their first dose while their immunity was still building. Just 0.2% of all people who had one dose of vaccine in that time frame since January 1st got COVID once 14 days had passed since that shot. This shows you the power of the vaccine at preventing infection. When we look at hospitalizations and fatalities, the same story emerges. Since January 1st, 93% of the COVID-19 cases that ended up needing hospital care were either not vaccinated at all or diagnosed with infection within 2 weeks of receiving their first dose. In that time frame since January 1st, up till yesterday, there were 706 deaths due to COVID-19. 88% of these deaths were in individuals who were unvaccinated or who were diagnosed with infection before the vaccine had a chance to be effective within those 2 weeks from their first dose. These numbers reinforce just how important vaccines are. While no vaccine or treatment for any condition is ever perfect, these vaccines work better than we could have expected. We can expect both the number of hospitalizations and deaths due to COVID-19 to decrease even more as more of the population is protected by first and second doses. Our data also clearly show that vaccines are effective against the most common variants circulating in Alberta right now. In Alberta, one dose of an mRNA vaccine has proven to be 73% effective against infection with the B117 variant, which is the dominant strain in the province right now. 2 doses are 91% effective at preventing infection with this variant. In terms of the P1 variant, a single dose is 75% effective against infection, while 2 doses bump that up to 89%. I want to note that vaccine effectiveness estimates for AstraZeneca vaccine and effectiveness against other emerging variants aren't yet available for Alberta due to limited sample sizes. As soon as we have more reliable data for you on either of these, I will share it. All of the vaccine effectiveness information I've shared today and a whole lot more is now available online on our dashboard. This will be updated regularly. After 15 difficult months spent living and working in a global pandemic, we have safe, effective vaccines to get COVID-19 under control. I hope this data from here at home in Alberta helps demonstrate just how powerful these COVID-19 vaccines are. I also hope it motivates more people to get protected with their first and second doses as soon as they can. The evidence is clear. Vaccines work, and they save lives. By getting your vaccine, you're helping protect your health and the health of everyone around you. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you put through our first caller, please?
First is Kevin Nimick with CTV Calgary. Go ahead, Kevin.
Hi, Dr. Hinshaw. What do you think of the Sky Palace photos showing Premier Kenney, 3 ministers, and 4 other people on a patio?
I have seen the photos, and I think it's important to note that as we've moved into stage 1, with new rules coming into effect, I think there's always a bit of confusion about which rules apply in which settings. So I want to just lay out a little bit about the different kinds of settings in which rules apply. So in outdoor social gatherings, we are now allowing up to 10 people who are present at an outdoor social gathering. As long as those individuals are 2 meters apart, we don't require masks at outdoor social gatherings. However, people should be wearing masks if they're less than 2 meters apart. We allow food at outdoor social gatherings, although we recommend that it not be shared person to person. And in fact, caterers are able to serve food as long as that outdoor social gathering has no more than that maximum amount of 10. That is different from the rules on restaurant patios, and I know there's been some confusion about why that is. Restaurant patios must have no more than 4 people at a table, and those individuals need to be from the same household or someone who lives alone and their close contacts. The reason why we have the different numbers for restaurant patios and for outdoor social gatherings is that on restaurant patios, it's extremely unlikely that people sitting around the same table will be able to be 2 meters distance. That's just not how those locations are set up. And of course, because there are many more people, again, gathered together in those patio settings, each, again, at that individual table spaced 2 meters apart. And so there are, again, slightly different rules, and the context, again, depends on which of those 2 sets of rules apply.
Kevin, is there a follow-up question?
Yeah, so you've seen the photos, so it appears the Premier and the ministers are not sitting 2 meters apart. Also, does it still count as an outdoor space if they had to traverse through an indoor space to get there, like a patio? So is the Premier following the public health orders?
It's hard to say in the photos. I guess I would say I wasn't there, so I'm not certain whether or not they were exactly 2 meters apart. What I would say is that, again, it's important for Albertans to understand the rules that apply in those different contexts. And again, that 2 meter requirement is part of those outdoor social gathering requirements. With respect to traversing through an indoor space, one of the other things in different contexts, of course, in workspaces right now, people are able to be indoors in workspaces where it is operationally required for them to be there. And so in a workspace, again, that in this particular instance is a part of the picture in terms of whether being indoors in a workspace, moving then to an outdoors gathering is a part of the overall picture. In general, again, we would say when Albertans are gathered at an outdoor social gathering, if it's at a park, for example, and there's a shared washroom facility, people are able to go in and use that washroom. There are those cleaning requirements that are part of the protocols to minimize risks. And so again, each of those specific contexts, we would be asking Albertans to minimize time indoors. But again, in this particular context, the workspace element is a potential complicating factor.
Operator, could you put through the next caller, please?
Next is James Keller with the Globe and Mail. Go ahead, James.
Hi, Dr. Hinshaw. What level of natural immunity through infection do you believe exists within the province? And how do you factor that into the question of, what is the broad immunity coverage and is it safe to reopen?
When we look at the last round of serology data that's available to us from the sampling, the prevalent sampling that we had been doing up until early February, we can see that at that point in time, we had a percent positivity of our serology that was at about 5% when adjusted for population. And that would have been reflective of the state at about mid-January, as we know that it takes a couple of weeks between when someone's infected and when they would reliably have antibodies against the disease. And so when we look at that number of about 5% in mid-January, when we look at the cases we've diagnosed, and we know based on our historical serology compared with diagnosed infection, we typically diagnose about 25% of the cases that we see through serology. Based on the third wave numbers, based on the baseline serology prevalence, we're estimating that our post-infection immunity would sit at about 12 to 14% at this point in time. And again, some of those individuals who had infection then may have gone on to get a vaccine. Indeed, that's what we recommend, is that those who've had COVID-19 still receive a vaccine to improve their overall immunity. But again, we anticipate that would give that cushion of about that sort of 12 to 14% over and above the vaccine protection that we're seeing in the population. And that's the number that we've used to calculate that overall population protection with the target of 70% at least first dose coverage in those who are 12 or older.
James, is there a follow-up question? James, are you still there?
It appears James has disconnected. So we'll move to the next question. This is from Michelle Delfontaine with CBC. Go ahead, Michelle.
Hi, Dr. Hinshaw. In your answer to Kevin Mimick, you indicated that you weren't there with the patio dining room pictures that we saw of the Premier and 3 of his cabinet ministers, as well as some staffers. I'm going to ask you this. From what you saw in those photos, and those photos are all over the internet, was the Premier and his 3 cabinet ministers and his staff members complying with the rules for outdoor gatherings that came into effect on Tuesday under the Phase 1 reopening?
Again, it's difficult in a picture, depending on perspective, to know exactly. So I would say that I'm not able to say with certainty. But what's really important for Albertans to know, and again, my job as the Chief MOH is to ensure that Albertans know the requirements, and those requirements are that in outdoor social gatherings, 2 meters of distancing is maintained. And if that's not possible at all times, then masks can add an extra layer of protection, although they are not recommended.
Michelle, is there a follow-up question?
Yeah, I'm curious about why you won't say what everybody else is seeing there, that they are not 2 meters apart, which tells me that they are not complying with Phase 1 of the province's reopening plan for outdoor social gatherings. So I'm wondering if you could explain to Albertans why you won't say what is pretty clear in those photos.
Again, it's my job to make sure that people know the rules and the perspective in those photos. Again, I just simply can't say with certainty. So what is important, again, is for people to know what those rules are. And for all of us, this is a really critical time right now. And so I recognize that there is frustration based on what appears to be the case in those photos. And I understand that. Again, my job is to say that for all of us, the critical piece is that we are mindful of what those rules are, and the 2 meters is required as a part of outdoor social gatherings. In this particular case, again, unfortunately, without having the opportunity to really document that 2 meters, I'm not able to say with certainty. And so again, I want to really focus on my job, which is to look at how we in Alberta can keep each other safe, which is following the rules in place right now.
All right, we've got time for 3 more callers. Operator, could you put through the next one, please? Operator, are you there?
Yes, I'm sorry. Can you hear me now?
Yes, we can.
Okay, our next question is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. The 2 thresholds for reopening have centered around first dose vaccinations and hospitalizations. Now, both you and the Premier have said leading indicators and second doses are embedded into the reopening plan, but they're not mentioned anywhere in the plan, and there are no thresholds for either of them in the plan. So can you explain how specifically those 2 are a part of the reopening plan?
When we looked at the experiences that other jurisdictions around the world have had with their reopening, and when we looked at the combination of post-infection immunity along with first and second dose immunity that they had, and we looked at what it would take to get to about a 70% protection level in the public, again, bringing together post-infection immunity, bringing together first dose, which we estimated to provide about 75% protection, second dose at about 90% protection. When we looked at all of those different things and we estimated that our second dose coverage would be relatively stable and increasing over time, while that wasn't a metric that was included, it was embedded in those calculations. And really, again, looking at all of those factors, that's where we saw that if we were able to achieve at least one dose in those who were 12 and older, in 70% of that population or greater, that between the post-infection immunity as well as the second dose protection, that all of those things combined would get us to that 70% protection, which was seen to be effective in other jurisdictions when they were reopening at, again, lower levels of transmission. And so I think we've seen our case rates dropping, which is a critical part of success, as well as our overall vaccination rates rising. And so, again, those things were embedded, and we wanted to make sure that as we were communicating to Albertans, we were using very understandable metrics and, again, wanted to use that leading edge metric of those first dose coverage pieces, knowing that the second dose would be coming along behind, and that post-infection immunity, again, was based on the cases that we'd seen and then that presumed population level of protection.
Julia, is there a follow-up question?
Yes, thank you. The Edmonton Zone Medical Staff Association has sent a letter to the Premier, and you were CC'd on it. They're recommending several different things in regards to the reopening plan, one of which is recommending that groups at high risk be prioritized for second doses. As of right now, the province has based that on the month that people were vaccinated. So where does Alberta Health stand on whether those who are elderly, those who fell into phase 2B of the vaccine rollout, those who work in work camps and meatpacking plants and those types of places, on whether they should be prioritized for second doses?
The really excellent thing about the way that our first dose sequencing rolled out and how that translates into our second dose sequencing is that we spent a lot of time on our first dose sequencing, making sure that we were putting those at highest risk earliest in their eligibility for their first dose. And so the timing of when people got their first dose actually is exactly all about the risk factors that those individuals have for severe outcomes. And based on the fact that we have sufficient vaccine supply coming in right now to be able to offer second doses to everyone who had their first dose in March or earlier within just a 2-week time frame, and then April, which is again when most of those individuals in phase 2 of the vaccine eligibility would have gotten their doses. That would include some of those congregate settings that you mentioned, as well as those who have high-risk medical conditions. Again, we will be able to complete second doses within just a 2-week window based on the supply that's coming in. So the great thing is that the way that we can roll out second doses is both easy to understand by doing it by first dose of date of first dose administration, as well as actually then being sequenced by risk embedded into following our first dose sequencing.
Operator, could you put through our next caller, please?
Next is Rick Bell with the Calgary Sun. Go ahead, Rick.
Good afternoon, Doctor. I heard your answer concerning what you could and could not determine from the photo, so I understand that you weren't there. What I'm going to ask you is more about what you've always told us at every single one of these availabilities that we've had. You always tell us that we're all in this together. You tell us to follow the rules in a very unambiguous way. Just follow the rules as they're stated very clearly, and that at some point in time down the line we'll be free of a lot of these restrictions. So what I'm going to ask you is, we're talking about an event with the Premier of the province and the Health Minister of the province. These are the ultimate role models for the fight against the deadly COVID virus. Do you think it has made it more difficult for you and others to give us the message you give us when you have a situation as it is depicted in the photographs that have been on the internet?
It's, again, I stand by what I have always said, which is that it's critical for all of us to follow the requirements and public health measures in place. With respect to role models and setting an example, I think all of us sometimes make mistakes as we are doing our best to follow the rules in place. And so there's a variety of ways that all of us can model the way. And some of that is by, again, where we're doing our best to follow the rules in place and there's a mistake made, that we acknowledge that and move on and make sure that that is a part of how we're modeling the way forward.
Rick, is there a follow-up question?
Yes, thanks for that explanation, Doctor. But the individuals involved have not acknowledged a mistake. In fact, they said there was no mistake. They did not make a mistake. In fact, they claim that the people who are drawing this to your attention and to the attention of Albertans are probably the ones making the mistake. I think I'd just like to know, because there are things I would like to do which I cannot do now, and I know a lot of my readers and a lot of viewers of people, other media outlets, who want to do things that they can't do now, and they see this picture. That's the context. So what do you have to say about what was in the picture as it relates to getting the rest of us who are behaving unequivocally and unambiguously to the rules? Wouldn't it have been just easier if they had just stalled the dinner maybe for a week, maybe until we were in stage 2 and people were back in gyms and back inside restaurants and back in bars and they were feeling a lot more open and feeling the freedom more? Maybe it wouldn't be a story. What would have been so hard about just holding off on that dinner until another time, a week, 2, 3 weeks from now? I mean, that's my question. That's where the frustration is coming from.
Understandable. I would say that we've been very clear that outdoor events are lower risk than indoor events, and ensuring that, you know, if people are together, having that happen outdoors is an important part of mitigating the risk. Again, whether or not a mistake was made really comes down to that question of distancing. It's clear that 2 meters is required in outdoor social gatherings, and so again, I'm not able to comment on that. However, that is kind of the key here, and again, it really does come back to the fact that all of us have the opportunity right now, today, to make a difference for our neighbours, ourselves, and our communities by sticking to those rules. And again, that question of mistake and how we move on from that, I can't comment on whether or not those 2 meters were continually followed. Again, that's not something that I can definitively say, and so that's really what it boils down to. But again, whether or not that 2 meters was followed, I want to reiterate what I said earlier, which is that all of us have a role to play, and it's critical that in this time period where we're seeing our colleagues, our fellow Albertans get protection at a higher rate every single day, that we hold to those measures so that we can lower the infection rate while we increase the protection. And that is something that all of us need to embrace.
Operator, could you put through our final caller, please?
The final caller in the queue, we have James Keller reconnected for his follow-up question. So go ahead, James.
Great, thanks for that. I just had a follow-up to that question on herd immunity, natural immunity. You talked about 12 to 14% over and above the rate that we've got vaccinated. Why is it over and above? Because as you acknowledged, some of those people that had COVID will also get vaccinated. So I'm just wondering how you kind of calculate what the overall protection is, given all these different numbers and how they work together.
First of all, I just want to make a point in terms of language. So post-infection immunity absolutely was calculated in. I just want to make clear that receiving immunity from a vaccine is just as natural and, in fact, less potentially dangerous than having a level of protection after getting infected with the virus. So post-infection immunity was certainly part of those calculations. And the way that we adjusted for the fact that some of those individuals who would have been infected then ultimately went on to have a vaccine is by looking over time at the age-specific proportions of the population who would have been eligible for vaccines and calculating the uptake of that, and then removing them from that overall estimate of post-infection immunity to try to adjust for that duplication so we weren't double counting. And so that was taken into account in the calculations that went into making that estimate.
Thank you all for joining us. Dr. Hinshaw will provide another live update early next week. Have a safe evening.